Hi, this is Junaid, stroke neurocritical care and epilepsy specialist. Today we're going to talk about impact of pandemic on the financial considerations in terms of how the trends have changed because of the pandemic itself. So the major trends have changed significantly as far as what the impact of pandemic has been. First of all, there are two major trends that are more pulling up. Number one is direct pay and number two is concierge medicine. And then of course, we're going to discuss what the impact on physicians were and what the impact on hospitals is. So the direct pay is basically that the patient directly pays the physician in terms of a credit card swipe rather than going through the insurance. And this has taken up significantly during and post pandemic. And the reason behind it is that physicians have actually decided that it's cheaper for them to actually not go through the whole hassle of insurances, paperwork and everything, and just charge less money and it still come up ahead. As a matter of fact, there are physician friends of mine, especially in neurology, that they're offering a neurology visit for $99 via credit card. And that's interesting because if the patient is supposed to pay via insurance, technically the copay is somewhere around $70 to $80. So for the patient, it's also a win. For a physician, it's a win because they don't have to go through the whole darn paperwork, hire back office people to manage insurance claims, etc. And therefore, direct pay is on a significant rise. As a matter of fact, major companies like CVS, pharmacies, etc. have also deployed $50 visits because it's available easily via telehealth and sometimes even in person, because it's direct pay. It's just the whole backlog of paperwork has been neglected, and this has been on the rise before pandemic, but post pandemic with the telehealth, this actually significantly increased. The other increase we have seen is in the concierge medicine, and the boom actually has been going on, especially in psychiatry and primary care physician. But there is a little difference. In concierge medicine, you can also build insurance companies, and that's we have seen is also increasing as we move along. Physicians did lose a lot during the pandemic in terms of job losses, in terms of volume losses, in terms of reduction in patients, etc. And then we have seen that decline has translated also in terms of burnout as well, because then you have to have expenses that are static, but unfortunately the income has gone down. However, in terms of income decline, private practices especially have reported 55% decrease in revenue, 60% decrease in patient volume. That's huge because, think about it. You are working at the end of the day a business and you have to provide a service. And if you are not able to provide a service, you're not able to pay your employees, you're not able to pay your expenses. Government did help out, especially here in the United States, but clearly there was a significant loss of revenue, especially for the proceduralists, because literally they dried out because elective surgeries were completely gone. So there is a huge difference in terms of impact on different subspecialties, those who can shore up into a virtual care, those who can't, etc. So we have seen that shift because of the pandemic itself. The reason I'm telling you that is that you have to take that into account, because whenever you're making a choice of subspecialty, again, you have to make sure that you understand the changing virtual digital healthcare arena and what your space is going to be in your medical specialty when you are going to be practicing on a regular basis. Unfortunately, hospitals did lose a big, because AHA estimates about $202 billion losses in American healthcare system. That's $50 billion per month. That's a huge amount of loss that hospitals had to suffer because of the pandemic itself. Clearly, there was reduced revenue. Again, as I said, elective surgeries were gone, but more importantly, there was increased costs, PPE, etc. So therefore, ventilators, ICU admissions, other mandatory changes around it in terms of making sure that there's proper barriers in terms of transmission, etc. So we actually see a significant amount of increase in the cost, while of course simultaneously a significant decrease in revenue, which is generated by elective surgeries as police in the hospital systems. So clearly hospitals did lose a significant amount. Again, all these resources for these references are on the Academy website. Please make sure you check them and follow. Thank you.
If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.